Hello, this is Steve Truitt with MedFair. I wanted to talk to you a little bit about something that's dramatically causing problems in the healthcare industry that's affecting us all. And it is becoming larger than you could even imagine. And that's the hospital-acquired infections, or HAI. Some statistics that you may or may not be aware of. The CDC has projected in 2018 that the HAIs will affect 5 to 10% of all hospitalized patients per year just in this country, resulting in 99,000 deaths with an estimated healthcare cost to all of us of $20 billion. That is catastrophic by itself. But if that was the only problem, we might be able to absorb it. But sadly, it's not. The revenue losses to hospitals come from many more areas. For example, the CMS penalties, or the Centers for Medicaid and Medicare Services. Those penalties this year, according to the government, those hospital readmission penalties are going to result in penalties to 2,573 hospitals. Is yours one of those? And do you know what that penalty is going to be? The government has already put it in print. This year, it will be $564 million, averaging $219,000 per hospital. So if you're one of those 2,573 hospitals, you're going to be paying $219,000 this year in CMS penalties. On top of that, your patient satisfaction scores are going to drop. And then on top of that is going to be the litigation expenses. And this is not only expensive, but it's public. A typical U.S. hospital is the target of an average of 7 HAI-related lawsuits. The average settlement of those 7 lawsuits per hospital is $1.5 million per hospital, per case, averaging in $10.5 million of cost per hospital. And then the Clinical Leadership and Infection Control has also stated that all-cause readmissions, now this is broken bones, infections, pneumonia, heart disease, anything, all of them all put together average, that loss will be $11,200 per readmission. And with that readmission rate projected to be 21.2% per hospital. And then the RID, or the Reduced Infection Deaths Committee, they say additional hospital costs when a patient says they've contracted an infection in that survey, $15,275 per survey complaint. Now, with all of those things considered, what are we going to do about that? Well, at MedFair, we've made a commitment to develop a program and products that can help you fix this problem. We also have awareness campaigns that will help. What we call the program is the MedFair MPI protocol. Now, what is that? The CDC has said the acronym MPI is non-pharmaceutical intervention. So what that means is we're not talking about medicine, we're not talking about vaccination, nothing like that, because that's not our specialty. But it's doing something other than pharmaceutical to help the problem, to fix or slow the spread of an influenza, especially pandemic influenzas that can happen, or MRSA. Now we can do something about that together. For example, this 3-step process talks about simple things that can be done that are very, very inexpensive. But first I want to start with a misconception. So many people that are producing these non-skid trays for food are telling people, like you, that if you buy our trays, you don't have to have tray liners anymore. That will offset the cost of paying for the higher price non-skid trays. Nothing is further from the truth. Actually, the opposite is true. Non-skid trays will attract more bacteria than a regular tray. But here's the good news. If you have a non-skid tray, you can use a regular tray liner in saving cost and not have to pay extra for a non-skid tray liner. So that part is good. But you're probably not going to believe me that you need to have tray liners on your non-skid trays, because I produce tray liners. So I don't want you to take my word for it. I want you to look at the link below. Click on that link and look at that study from the Science Research Group from the Food Protection Laboratory of the Syracuse Research Corporation. Just take a few minutes to read that. That's not from me, that's not from MedFair, that is from the Syracuse Research Corporation. And they say in there that when you use a tray cover like we produce here at MedFair, you place that on your tray, non-skid or regular tray, doesn't matter. You're going to reduce the bacteria on the surface of that tray from 150.1 to 0. And that's a fact. And you can look at that in that research. So that's the first thing that we need to do in this 3-step process, is to explain why we need to use tray liners, taking the bacteria out of the equation. The second thing is dietary kits. Now, we offer several kinds of dietary kits. You'll see them here in a minute. But we have the sealed packages with the cutlery already in it that are completely sanitary. And we recommend that you use that to eliminate that possibility. Now, we also have those that you can use your own silverware in with a little slit in the end as well. And we can customize all that, and we'll show you that here in a minute. Matter of fact, why don't you look at it now? Here's an example of a hygiene tray kit, which includes, as you see here, the tray liner, a matching 8.5 by 14 menu that's perfect, that you can imprint in your hospital on the inside so that you can put your own food items on it, a pocket matching napkin, and a patient hand wipe. That's the hygiene tray kit that is so reasonable. I'm going to explain that to you in a minute. And then these are examples of the dietary kits, and we also have for pediatrics their own hand wipe and their own dietary kit as well, as you can see there. But I want to show you the difference in hand wipes. Here's our competitor. Of course, everyone knows the name Purell. Okay, first of all, look at the size of it. Here's ours. Look at the size of that. One other I want to bring to your attention. Here's the directions on the back of the Purell wipe. It says, wipe hands. That's it. On the back of ours, it tells your patients to remove and unfold wipe. Wipe your hands thoroughly for approximately 15 seconds before discarding. So your patient knows what to do with these. Now, I want to show you another big difference. When you open up the Purell wipe, you'll see that there's wax on the inside. The wipe itself is paper. It's very sticky because the only ingredient is a reduced amount of ethyl alcohol. And the alcohol just runs off of it, and you can smell it, and it smells terrible. I don't even want to wipe my hands with that. It's disgusting. That's the Purell wipe. See how it's dripped even on my desk? Now look at the difference. Ours opens easy because it's scored, it's foil lined. The wipe itself comes out, it's cloth. It's not paper. You can see the difference. And you wipe your hands with it, it feels good. It's got aloe in it, it's got vitamin E, it smells good. It doesn't drip all over the place, and it doesn't leave your hands feeling sticky. And just a brief 15-second wash, your patient's hands are completely sanitized and ready to enjoy their meal. And in addition to that, they're also date stamped on the back so that you are guaranteed the full effectiveness of this wipe. They are fantastic, and the hospitals that are using them are just feeling that they're just the best decision that they've made. So here's the best news possible. This whole kit right here that you see is less than 19 cents a meal, depending on who your GPO is, but less than 19 cents per meal. I want to say that again, 19 cents per meal. Now let me just do a little simple math for you. Most hospitals will say, well, I don't have anything in my budget to pay for that. You don't have to. We're fixing that problem for you here at MedFair. Just listen to this math. When, not if, but when you reduce your 30-day readmissions by 1, you'll do that immediately, just like that. And reduce your patient saying on their CMS surveys that they think they might have picked up an infection in the hospital. You reduce that by 1. Just those 2 reductions. If your hospital is, say for example, a 150-bed hospital with 125 census, the savings that you're going to save just by those 2 reductions, 1 each in those 2 areas, will pay for this hygiene kit for your entire year, including shipping to your hospital. Now, there's more good news. Think about this. Every reduction to those 2 surveys that comes after the first one, and you'll have many, believe me, the hospitals that are using this have said they've reduced their 30-day readmissions, and they have reduced their CMS surveys. But I'm just talking about one that will pay for all of this. For every one after that you save, $26,475 will go to your bottom line. For every single reduction after the first one that pays for our product. So Medfair's savings to you is going to become a revenue stream for your hospital. Your infectious disease department's going to love it. Your CEO is going to love it. Your CFO is going to love it. And you're going to be a hero by putting this in your plan. And that's not even talking about dramatically reducing your AHI litigation costs and your CMS penalties. And your patient satisfaction scores are going to do what? They're going to go straight up. So look down below, look at the link. You'll see a phone number. Call us, email us, contact Medfair, because we're here to help take the sting of this healthcare crisis off your back.